My observation is that while this is, I think, an important opening of the aperture to an understanding that our health can't just be determined by medical care, it still takes an essentially individual approach. It treats that as a deficit that can be filled with a service. We're in conversation, let's say, with 20 states that are launching these programs in Medicaid. What types of things might they be able to do in the context of those programs that embrace what you've learned and can take this empowering community approach?
I like to simplify to these three things. The three ingredients for health equity boil down to A, B, C. A stands for agency, which is basically power. It's the ability at the community level to essentially hold systems accountable for equitable outcomes. Now, the B stands for belonging. Belonging, in many ways, to my definition, is basically the opposite of racism. Racism is designed to keep people out, to exclude them, to marginalize them, to dehumanize them. Belonging is the opposite. Belonging is the ability in a community to essentially have your story known, to have your humanity recognized by others, to recognize that our fates are inextricably intertwined with each other and that, our well-being is dependent on the well-being of others. And belonging is shaped through narrative, through stories about who belongs. And C is essentially fundamental conditions, or I like to refer to it as the social contract. And the social contract is basically those investments in all of our well-being, like universal health care, universal childcare, universal paid sick leave, emphasis on the word universal.